face some of the issues that they do, and how folks end up becoming undocumented as a result. And then we're going to cut straight into telling a few stories about our members and some of their experiences as a result of COVID-19, as a way to kind of ground the conversation a little bit in people's realities and some of the work and the issues, the struggles that people are experiencing right now. And hopefully that will really illuminate for folks kind of some of the bigger picture stuff that we are talking about. So both Hassan and I work for the Migrant Workers Alliance for Change. We are based in Ontario. Migrant Workers Alliance for Change is both a coalition and an organization. So as a coalition, we are have 23 members, migrant-led and migrant-supporting groups in Ontario, who we come together to do joint work on advocacy and policy change and reform on behalf of migrant workers. And then as an organization, Migrant Workers Alliance for Change is also organizing directly with migrant workers in Ontario. And so we are organizing specifically with migrant farm workers in the Niagara region, as well as with migrant students, so international students that are here on study visas and who also work. So we run 3 hotlines for workers through our work as MWAC, for migrant students, for farm workers in English and in Spanish. And through those hotlines, we provide legal information and support and advocacy for some of the issues that workers are facing. But also through that, we connect with workers, we build a network and a base of workers and support the formation of local farm-based or campus-based groups of migrant workers who together and for themselves identify some of the needs they're facing, the needs that they have, and some of the priorities for taking action to change the living and working conditions and the policies and the laws that contribute to the living and working conditions that they're experiencing. The Migrant Workers Alliance for Change is also the secretariat of the Migrant Rights Network. So the Migrant Rights Network is a national cross-country coalition. It's the largest migrant justice coalition in the country. We have 43 members across the country. Migrant justice groups, again, migrant-led and migrant-supporting groups. The vast majority of them are grassroots, volunteer-run groups. Many of them are run by migrants themselves or former temporary migrants. Similarly to what MWAC does, they provide direct support to migrant and undocumented communities, and then bring their migrant members into local and regional, provincial, and national efforts for policy and legal change. In the time of COVID-19, all of our organizations, like many others, have had to kick into really high gear, providing immediate crisis support for our members and their families and migrant communities, everything from food deliveries, emergency housing, access to emergency health care, and so on. So that's just sort of a quick snapshot of sort of who we are. And because as MWAC, Hassan and I are situated both doing the work of Migrant Workers Alliance for Change in Ontario, but also coordinating this national level work, we're going to try and bring in the perspective of all of these organizations that are supporting migrant and undocumented communities across the country. So I'll pass it over to Hassan to provide a little bit of the policy and the legal context.
Thank you, Karen, and hi, everyone. So I want to sort of situate what it is we're talking about because the scale of the crisis may be uncertain to some. Every year, 750,000 people come into the country on temporary permits, temporary work permits, temporary study permits, or as refugee claimants. That's 750,000. Many of those people are unable to maintain their status, so at one point or the other, they become undocumented. As a result, if you include migrants who are both temporary with some permits or with no status in the country, we are talking about at a minimum between 1.6 and 1.8 million people in the country. That's the most conservative estimate. Some people put the numbers at 500,000 higher. But even at that conservative estimate, what that means is that 1 in 23 people in this country are non-permanent residents. That is a massive scale, and it completely determines how people live, how people work, how they access services. If you don't have permanent resident status, you are unable to be with your family, In many cases, you are not able to get healthcare, you're not able to get education, you may not be able to get social assistance, you may not be able to assert your rights to work because speaking out against a bad job can result in deportation. If we think about some of these categories specifically that make up our migrant members in our migrant communities, for example, agricultural workers are here on employer-dependent permits, which means that they cannot change a job without first finding a new employer who then applies for a labor market impact assessment that takes 3 to 6 months and costs $1,000, then getting a new work permit that also takes 3 to 6 months and costs $150. So leaving a bad job means potentially 6 months of unemployment. But because these migrant workers are living in the homes of their employers, that means that they're going to also be homeless. So imagine how difficult it is to leave a bad job. This crisis is such that in the last census, the rate of low-income people within non-permanent residence was 42.7%. Over 42% of non-permanent residents who filled out the census said their income was below the low-income cutoff. Just to give you a sense, the average in Canada is 12%. And for immigrants, racialized immigrants, it's 17%. But for non-permanent residents, it's over 42%. Our people are the poorest people in the country as far as the status census is concerned. And remember that many undocumented people who make much lower income did not fill out this census because they were very scared of the repercussions of it. So the data is actually skewed and it's potentially much higher. What we are facing in COVID-19, and we'll tell you a few more stories, is that this existing crisis of poverty, apologies, I will slow down, apologies. So what we're facing in COVID-19 is that the existing crisis of poverty, exclusion, lack of ability to assert your basic rights is gravely exacerbated. We are in the face of despair. We are seeing our communities unable to feed themselves. We're seeing people unable to get healthcare. We're seeing people losing income at an immense and unqualified rate, and no federal income supports to support them. Not just that, because people are so impoverished, so excluded from existing mechanisms, there is no cushion. And so what that means is that people are facing irreversible life consequences. If you lose income and you sell your car, and your car is the thing you use to get to work, then you've lost income for a long time. We have members who said we couldn't send money back home, and which means there's going to be no roof and the rainy season is coming and we're going to lose all our belongings. We have members who decided that because they didn't have enough income to have an unplanned, unaccompanied, unassisted home birth because they didn't have the money to pay for health. And that's going to have lifelong consequences. Surgeries are being abandoned. 3 months of rent already have been due, but people haven't had a paycheck in 2 months. And that means that people are selling their life belongings. So the important thing is that we're not going to really emerge from this crisis for a long time because people have already been set back to a point that they cannot recover from. When we think about our communities, between ag workers, temporary foreign workers, care workers, and documented people, international students, it's important to try and also situate them, appropriately between one at a time. So let me just tell you a little bit about one of our members who's a care worker. This is a person who's been in the country 7.5 years. They're supposed to be able to work for an employer for 24 months, get their hours of work settled. Like you have to basically finish 24 months of work experience and then you can apply for permanent residency status. However, she, because of needing to leave bad jobs, her employer died, she's been here for so much longer, but is not able to actually add up those hours. Now, in the context of COVID-19, she's unemployed and there's no jobs because nobody wants to hire a care worker to come into your home and take care of your families and your children. She's homeless because she doesn't have access to housing because your housing is tied to your employer, right? And what we've been able to do is we've been able to assist her to be able to get access to emergency income, emergency shelter. But there are hundreds and hundreds of people like that, just in the care worker industry. I'm going to pass it off to Karen, who can speak a little bit about some of the other groups of people we're working with.
Thanks, Hassan. We will spend a little bit of time talking about farm workers also. As Andrea mentioned, and as I'm sure a lot of folks have been hearing in the media, there has been a massive number of outbreaks on farms in Ontario in recent days of COVID-19. In fact, outside of the long-term care system, the largest outbreaks in Canada have been somewhere in the agri-food system. So in either on farms, in greenhouses, or in food processing. And that industry is dominated by temporary migrant work. So our organizers with Migrant Workers Alliance for Change in Niagara, as I said, they operate hotlines for workers to call. Our organizer who operates the Spanish hotline received a phone call from a worker from Scotland Farms, which is where there is the largest outbreak in Ontario right now, currently over 180 confirmed COVID cases. She received a phone call from one of those workers who had been hospitalized. Him and 4 others had been taken to hospital with symptoms. 2 of them were in intensive care. He called her and said that they had been in hospital for 3 days and had not received any interpretation. No one had spoken to them in Spanish yet. They didn't know what kind of testing was being done. They didn't know for sure their diagnosis. They didn't know what treatment they were receiving, and their families back home had not been notified that they had fallen so gravely ill. Our organizer then stepped into the role of interpretation and translation, which is not really the kind of work that we do, but we do this kind of work in crisis times. And she was called upon the following day. So she was trying to arrange some interpretation and translation at the hospital for these workers. She was called the following day by an anesthesiologist who was treating one of those workers, asking her to urgently translate for him that he was going to be sedated so that he could be put on a ventilator. They passed the phone off to the worker, and the call was cut off before she was able to speak to him, and we since haven't heard from that worker. This is a sort of a situation of many layers of failures and of a broken system layered on top of each other. So we have been overwhelmed with phone calls from farm workers complaining about being sent to work before receiving test results for COVID-19, being mixed with workers who are sick, workers who live in substandard housing. We know this has been a longstanding issue, and it's in large part to blame for the COVID crisis that's happening on farms right now. 6 workers to a room, 20 workers to a house, 1 shower, no clean water, no access to PPE, no access to cleaning supplies, and workers working 14 or 16 hours a day, 7 days a week now to make up for the labor shortages caused by border closures and travel restrictions. And that have meant that far fewer of the migrant farm workers who normally come to Canada have been able to arrive. We also have other stories of folks who have fallen into different kinds of situations. We have a case worker that we've been supporting in Toronto who came to Canada with his wife. They were scammed by a fraudulent immigration consultant and came on tourist visas with the intention of applying for work permits and then eventually for PR. None of that paperwork was ever done or done correctly. And as a result, they ended up here without social insurance numbers and relying on under-the-table work in construction to be able to get by. That work obviously dried up because of COVID, but they were forced to still be going out to work despite being told to stay home and follow public health directives to stay home because they needed that money. They had no other supports, and his wife was pregnant. So they had no access to healthcare and they had no income support, not able to qualify for CERB, and with work drying up. They've since had their baby. They gave birth on May 20th. They have no OHIP. The hospital was wanting to charge them $10,000 up front to be able to give birth there. Instead, they found a midwife who they paid $4,500 to that they cannot afford. And who is now fighting to get them that money back because of their situation. This family has not been able to pay their May or June rent. So I know that we want to leave some time for questions. So I'll just wrap up by saying these are some really, really sort of limited snapshots of the state of the crisis that migrant and undocumented folks are finding themselves in right now, and the extent to which our organizations are scrambling to try and meet the need. Again, like I said, with food, access to food, providing access to emergency health care, all of these things that are essential for people to be able to survive and get to the end of the day. We've been fundraising bits of cash to be able to help people buy groceries. Like it's quite an extreme situation. And the level of need is extensive and far beyond the capacity of what our organizations are able to meet. We have a short video of some workers' testimonies. It's just a couple of minutes long that we wanted to play that helps kind of capture the picture of what's happening right now with COVID. Hassan is going to play that through screen share.
Now, I think because of the translation,
right.
I'm just going to drop them in the chat in English and in French, so people are able to see it.
So just so people know, these videos are from interviews of a press conference that we did in April with 7 undocumented workers who were explaining the level of crisis that they are in because of COVID-19 and the loss of work and income. And because of their immigration status, their inability to be able to find other work or to change, to leave bad jobs, and their inability in some cases to be able to apply for federal income supports through CERB. So though the video is stories from workers from across the country who have found themselves in these situations, explaining really why it's so necessary that the government be able to respond and provide these kinds of emergency supports to all, regardless of their immigration status. I think we'll leave it there to see if folks have any questions that they would like to ask, either of myself or Hassan.
Yeah, thanks, Karen. Thanks, Hassan. We will make sure that when we post this, because we're recording it, when we post it, we'll add another slide if we can, or we'll add some text so that we can make sure that we can include the video for those who weren't able to attend this live. I'd encourage those who are listening to put their questions into the chat box, and maybe I'll just start with a question while we give folks a moment, if that's okay. You know, I guess first an observation in the way that you have described, Karen, as you said, the many layers of failures of this system is quite, the ways in which you have shared the experiences of some of the individuals that your organization is supporting and that organizations in your network are supporting is really helpful. It's shocking and horrific, the experience that you have described, but also makes it very clear the need for additional supports, in particular when, as you have both pointed out, the other subsidies that are available are actually not available to this particular population. So I'm wondering if you can just tell us a little bit more about the network, the national network that you support, and perhaps some of the ways in which they are trying to ramp up or add additional capacities, get funding for additional capacities because of the need, the urgent need through the experience of COVID-19. So would love just to hear a little bit about what that means for those particular organizations.
So we have about 43 members in 10 provinces and who are working with various sectors, either just care workers, just farm workers, just students, just undocumented people, and some working with all of the above. By and large, everyone has gone into crisis support. So we are driving toilet paper and hygiene supplies to farms in the middle of the night because employers won't let us in the daytime. We are getting groceries to care workers because the employers won't let them leave the house. We are, as we mentioned during translation, ensuring people have access to healthcare who are undocumented, who otherwise cannot. We're running distribution centers, so we're fundraising online and we're distributing food, but primarily cash because rent is the biggest crisis. And so we have been fundraising and just distributing money, $300, $250, whatever we can, to migrant sex workers, for example, who aren't able to access any of the supports. Migrant workers at JBS and Cargill, where the outbreaks happened, the large meat packaging outbreaks. And in addition, we're helping people sort of navigate legal mechanisms, because all of the immigration offices are closed, which means there's no biometrics possible, which means thousands of applications are being turned down. We're also providing emergency, driving people, helping people move out of their homes. So we are doing everything and anything. I mean, just in addition to, we have these phone lines that are clogged. It's very difficult for us to go virtual. Members don't have access to Canadian cell phones, don't have data plans. So in some cases, we're fundraising and distributing cell phones, Wi-Fi cards, just so that, Wi-Fi hubs, just so people are able to get connected with us. So we're dropping them off in various locations. We're doing informational webinars. So for example, for migrant students, that is bringing 300, 500 students every week, or they were in the beginning. I think our numbers are a bit down now. So it's a very wide array of work, of crisis support. And just to reiterate what Karen had said, over 3/4 of the membership has no office, has no phone number, has no staff. And most of them are themselves migrants, including us. And so people are doing this so MWAC serves as the secretariat, the administrative body, the financial coordination, the support mechanism, because we're one of the very few organizations with actual staffing capacity to support. But by and large, these are people who themselves are going through economic crisis, personal health crisis, seeing their own family suffering here. And, we have families, we're in a global network. And the pandemic is hitting different countries around the world. So we're also dealing with that while trying to meet the basic needs that have been completely either forgotten or intentionally excluded by federal and provincial programs.
Thank you for that very thoughtful response. Karen, was there anything that you wanted to add?
No, I think, well, just to say, in terms of the diversity of the Migrant Rights Network membership, I think is really one of the valuable things that it brings, because in this time of crisis, we've been able to really share a lot of information. We're kind of an information sharing hub now for folks who are supporting people. And in this sort of crisis response mode, everybody is doing what they can. Information is piecemeal, policies and programs are changing constantly, realities are changing constantly on the ground. And so it's been very important for our member organizations to be able to connect with other organizations, in a different province who are serving maybe the same kind of population, and comparing notes about how people are dealing with evictions, comparing notes for how people are accessing CERB, comparing notes about things like that. That has really maximized the few resources that we have to be able to do this, and just to really sort of state that we're the only network in Canada that is doing this work right now to that degree. We're the only network that has this vast and diverse membership across the country with such a grassroots membership that is providing this immediate support. And so the wealth of information and knowledge that it's generating in terms of what this crisis is, how this crisis is being experienced by migrant and undocumented communities, is really rich and is really kind of unique in the country. So as much as our folks are stretched thin providing this kind of support, they are particularly well placed to provide the kind of support that migrant and undocumented communities need right now. And the fact of us being in a network like this together is allowing us to maximize, such as it is, our capacity to respond.
One thing I also wanted to add quickly is that the immigration settlement sector, all of these other sectors actually require people having permits. So you have to be a refugee claimant or a permanent resident. So most of those sectors are banned by their funding to provide services to the people we work with. And it's just important for people to understand who it is we're talking about, because sometimes if you're not sure, you think those are being served by that sector. Mm-hmm. By and large, there's of course exceptions.
Of course, that's a wonderful point. And I see in the chat there was a question about how do we find and reach out to local chapter or the local organizations that you're working with. And so Hassan, you have very generously included your email addresses for yourself and for Karen. I'm just not sure if everyone can see that or if it's just the panelists who can see it. Oh, and attendees, I take that back. So everyone can see that so they can reach out. Thank you both so much for sharing your time with us. We want to be really respectful of your time, given the tremendous work that is required and the work that you are doing. So on behalf of all of the community foundations, on behalf of CFC and my team, thank you both for joining us and for sharing the experiences of a population that I think we don't hear from enough, that we don't see enough in community. And so you've certainly shifted some perspectives today already. And we look forward to the opportunity to continue to build a relationship with you and with the work that you do, and to ensure that it continues much beyond COVID-19. So thank you.
Thank you so much, Andrea.
Thanks to you for the opportunity.
Okay, wonderful. And thank you to everyone for joining us. It has been wonderful to have you here once again for a lightning talk. We wish you a wonderful Friday afternoon. I hope it's sunny where you are, and a wonderful, wonderful weekend. We will see you on Monday. Thank you.